We have some reasonably good guidelines right now, for example, from the NCCN. For example, some general concepts are that if you have multiple family members who are younger, who have prostate cancer, if you have more than 2 to 3 male in a family who have prostate cancer under the age of, let's say, 55, should probably consider genetic testing. Also, any family that has a heavy burden of related cancers, what are the related cancers and hereditary cancer syndrome? So breast cancer, ovarian cancer, melanoma, pancreatic cancer. If you've got relatives in your family with those diseases and you have prostate cancer, it might be wise to consider genetic testing. Lastly, one of the least controversial areas right now in genetic testing for prostate cancer is for men who present with metastatic prostate cancer. And that is probably one of the biggest or areas that there's very little controversy about. The reason for that is not only is that about inheritance and inherited prostate cancer, but any day now we're going to have a new class of drugs in urology known as the PARP inhibitors that will be driven by that genetic testing. So that area is really probably the least controversial right now. But the other area is exactly who to screen, who not to screen, who should have genetic testing, who else in the family should have it. We're kind of finding a way. We have to remind everybody that over 80% of men who have prostate cancer have what we call sporadic prostate cancer. You can't point a finger to any inherited or familial clustering of the cancers. However, if you're in that 15 to 20% where there is a genetic connection, very important to consider genetic testing.